We're going to get started. So first of all, welcome and thank you for joining what I believe will be an exciting healthcare security discussion with industry experts from the health insurance industry. Today, we're going to discuss security challenges facing the health insurance industry. This webinar is being recorded. If you have any questions throughout the presentation, please feel free to drop them in the chat. I'll be monitoring that throughout the presentation. I'm Chris Lutz, and I'm the Vice President of the Healthcare Vertical Market here at Convergint. I have about 20 years of experience in the healthcare space, in the pharmaceutical, medical equipment, medical device, managed care, and healthcare technology segments. I'll be moderating today's discussion. This event's being sponsored by Convergint in the spirit of obviously industry education. We are the global leader in security systems integration. We're blessed to have great customers across the entire healthcare ecosystem, including Humana and Blue Cross Blue Shield. I'm honored to introduce our two panelists today. First up here is Burke Swartingan. He is currently the manager of physical security for Blue Cross Blue Shield, Alabama. Burke is a law enforcement and security professional with over 40 years of experience. He's an Auburn graduate. He has spent over 25 years as a police officer in Alabama, with several promotions over those years, where he retired as chief of police in the Homewood, Alabama Police Department until his retirement from the force in 2007. He then began a career in corporate security, working for Regions Bank before assuming the position in 2014 as manager of physical security at Blue Cross Blue Shield, Alabama. Burke is a 2006 graduate of the FBI National Academy in Quantico, Virginia. He's a certified chief of police and a graduate of the Aubrey Daniels Institute of Performance Management. He was appointed by the Alabama Speaker of the House in 2009. Burke was a founding member of the Alabama Security Regulatory Board, a state board that requires private security, regulates the private security industry. He served as the board chair from 2009 to 2015 and currently serves as vice chair. Burke is actively involved in numerous professional organizations, including the Birmingham chapter of ASIS, where he served as chair in 2003, the Metropolitan Justice Executives Association, and the FBI National Academy Associates. Currently, he is board chair of the Corporate Security Leadership Council, a security working group comprised of Blue Cross Blue Shield plan security managers. Steve Paziana is the Senior Executive and Director of Enterprise Safety and Security at Humana Incorporated. He is responsible for driving the development, execution, and management of proactive and predictive risk programs and security strategies dedicated to protecting the company's people, property, information, and reputation. Prior to joining Humana, Steve completed 7 years as a U.S. Marine Corps Commission Officer in Combat Arms and a Marine Corps Security Forces, before joining the U.S. Secret Service for an elite assignment leading, managing, and supervising investigations, physical security techniques, and ultimate protection for the president, first family, and heads of state. Steve earned an executive MBA from Bellarmine University and holds a Bachelor of Social Sciences from Xavier University. Steve is currently sponsor of MARC, which is Men Advocating for Real Change. He also holds a leadership position with the Domestic Security Alliance Council, or DSAC. In the fall of 2020, Steve represented Humana at the COVID-19 Road to Recovery event as a featured speaker, along with former President George W. Bush, Dr. Anthony Fauci, Dr. Sanjay Gupta, and Sir Richard Branson. Steve is an active volunteer with Team Rubicon, a volunteer and veteran-based emergency disaster organization. Burke, Steve, I want to thank you so much, obviously, for being panelists today on this panel. I want to thank those that are attending in the audience as well. Again, just as a reminder, the chat function is there. Should you have questions throughout, I will monitor that. I will start with the first question, and Steve, it will go to you. And this is in a couple different parts. So today's climate's becoming increasingly violent, resulting in security and safety concerns across the globe. How are you navigating and managing these new threats in your facilities? What training are you doing for your colleagues? And what technology are you deploying to help solve these challenges? And maybe a little bit about, kind of what's been the impact, and then Burke will come to you with the same question.
Sure. Thanks, Chris. Yeah, so great question, of course, Chris. Obviously, we are seeing that the environment today is becoming a bit more high risk than it would have been in the past. I will tell you the first thing that comes to mind is definitely the training piece, like you're asking, but really the relationship piece. I think what we've learned is that within our team, especially, and even with my senior leaders, we often get asked who are the subject matter experts in some of these spaces, especially with the emerging threats, whether it's a civil unrest environment or it's a pandemic environment. I will tell you that over the last couple of years, our relationships with our internal partners, of course, specifically IT from a technology part of your question, but also with our risk practitioners, and then with even our external partners like DSAC, you mentioned, our federal agencies, of course, locally here. One of the larger impacts is that we do have about 800 rooftops or so across the U.S. And so having that relationship locally has been really, really important for us, and has been really, really successful. So the training piece that comes on the back end of that, a lot of what we've been doing for our associates has been just best practice when it comes to whether it's active assailant training through a DHS portal, or it's something that the Bureau from a cybersecurity perspective is actually training us on. Again, not being the subject matter experts in every potential space around this risk, we really go out and look for partners, again, even strategic business partners like Convergint and others that really have a larger view of what customers like Burke and I are experiencing or what our needs are. But we do have the basic skill set package, education package required for associates. One of the newer technologies on your back end of your question has been that, again, we're all, for the most part, operating a lot more remote than we had been in the past. People are working from home. The expectation is that, as it once may have been, that when you hit a Humana facility, that we sort of provided that safe and secure environment for you. Now the expectation is that we're providing it to you while you're in your home working, like many of us are today. And then also to those people that are reaching out to members, for example, have what they need, and the way from an educational perspective on how to report incidents, right? So it's sort of back to the basics. And having a team meeting this morning, it came up again. With our culture here at Humana, we are really engaged when it comes to understanding what our associates' needs are. We have these listening data tools. So again, from a technology perspective, understanding, whether it's a survey or it's a conversation, what is on the minds of the associates. I will tell you right now that the number one conversation this morning was around personal safety, right? So that's good for us to know. And my next question was, what type of topics are those people that are saying personal safety is their concern are interested in knowing more about, right? We've done this before. Some of it is about reporting incidents. Some of it is about what app can I use on my phone to support me when I'm working here at home? What can I do to understand what I should do if something, like we talked about in the pre-conversation, weather impacts my home? So really it's about building those relationships, sort of reestablishing what the expectations are of our associates or our members, and then building those relationships, because we as a safety and security team obviously can't do it on our own. And so it's really just leveraging others and your subject matter expertise as well. Chris, I think you may be on mute.
Yeah, I was following directions.
Yep.
So, thank you, Steve. Burke.
Yeah, thanks, Chris, and everybody at Convergint for having me and hosting this great event. I couldn't agree more, particularly with one thing that Stephen said. It's all about relationships, internal relationships as well as external relationships, and we do have great internal collaborative relationships with other partners, in the company in regard to this as well as externally. And so we have a number of tools and resources to stay abreast of what's going on in our world here locally and throughout our corporate footprint. A lot of it is through networking and relationships, through professional organizations and security briefings that we get. But I also want to really stress that, going back to the relationships is all of the blue plans. We do have a working group of what we call the Corporate Security Leadership Council, and we meet and collaborate regularly. And often, much of the conversation is around is we're experiencing this, or we have just experienced this. Please, be aware. And so we do that, and we work to stay abreast. Training is a big part of what we do, particularly for our associates. And we require all of our associates to go through security training day one. Every Monday, the new hire class, they go through security training. And then part of not only we teach them what to do, but we also encourage them that, you play a part in our security role, that you're the eyes and the ears of what's going on, and that it's important to report that. So I really stress that in our training with our associates, and that it's just not a physical security role to keep us safe. It's us working together with the associates to do that. And so, in this training that we do day one, we reinforce it annually. There's a piece of online training that we make every associate go through that reinforces this, so that it's not a one and done. Then talking about the technology piece, we over the last few years have completely upgraded all of our electronic or physical security applications, from our card access system, our visitor identity and personal identity management systems, our cameras. All of it has been completely new, completely upgraded. And so we rely real heavily on that as a big part of our security piece. And so, all of these things working together in conjunction, where we put our emphasis in this area of just trying to keep everyone safe and to be ready to respond to whatever may be out there.
I'm going to ask a question of both of you, actually, and if Burke, since you're on the mic, we'll go to you, and then maybe Steve. You think about the Tulsa incident, right? Obviously, in the member community, right? And what was learned there was a training opportunity, maybe a little bit of a breakdown there. Was there anything you gleaned from that situation that you think, hey, that's going to cause me to maybe improve, our training, or think about how we train a little bit differently? I don't know, one of you want to answer it. Steve, you can come off mute if you want to, too. I'll go on mute.
Anytime something like that happens, I always take a pause and I look at it and I think, okay, is there something there for us, a lesson learned for us? And the one there that really, is training. So it got me to thinking about, okay, when we do our hostile intruder training with our security team, do we need to think differently? A little bit differently, and be prepared for more things. And then the other was just what's being reported in the news media anyway, is that a doctor was targeted, and so and he was targeted for, apparently in the eyes of the assailant, not providing good care. And so what does that mean for us, being in the health industry? May they at some point want to take that out on us if they blame us for some of their issues? And I think a lot of that goes back to situational awareness. All of these situations, was there any red flags and warning signs that were missed? And if so, why were they missed, or were they out there and someone failed to report it? So I think that's where it's real important that you stress continuously to your associates, you are part of the security plan, and you need to report things of concern. And we would rather you over-report than under-report. And I'll never criticize someone for reporting something that turned out to be nothing, because you just never know.
Yeah, and Chris, I obviously agree with everything that Burke had mentioned. Not much more I can add, except for probably the fact that, we have lots of cases, internal, external, like Tulsa, where we actually we utilize those specific cases to learn more, right? Again, it's not to necessarily armchair quarterback what occurred or what didn't occur. It's what could we do so that we can better educate our clinicians in that space to do something different. Believe me, and I'm sure Burke was on the receiving end of a lot of emails too. Unfortunate events create people who don't think about safety and security all the time to sort of over-index on that and want to just completely eliminate the risk that we're all living with in each of our environments. And so it's that conversation. That has to take place with those senior leaders. It has to sort of be, obviously when it comes to the list of services that we can provide, training's part of that. We cannot prevent everything from occurring, but we can, continually educate. And, one of the great progressive techniques that we've had on this team, and we've been empowered by our leadership to do it, is we're lucky enough to have a team of learning design professionals built into our team that can look at that use case and say, okay, we have adults, this is our audience, or we have clinicians, this is our audience. What do they need to know so that we can say, if in heaven forbid this were to occur, that we've done what we can do, and again, to support them. So again, it goes back to your first question, of course, probably why you're asking it, is it goes back to that education and training. In that particular situation, not knowing all the details, I'm not sure what could have been done different, right? You can't keep every door on a clinic closed to members. But I'm sure when you start peeling it back a little bit, there may have been some social cues that this individual may have provided to that doctor in the past. Again, like Burke said, underreporting is absolutely occurring. So, encouraging people to say something when they see something is obviously something that we all are fully aware of. Very, very important.
No, I appreciate that. Burke, this next question is going to come to you to start. One thing I get out of it is, take those training, the security training that you get as a colleague in your organization seriously, because no one ever looks at it until an incident occurs and you say, well, what could I have done differently, right? So I think that's really good. So Burke, coming to you, obviously the COVID pandemic, which we're still living in, hopefully on the tail end of it, but it's still a reality, right? Has certainly brought about new safety and security concerns. How's your organization evolved during the pandemic to make sure your visitors and staff are safe and secure?
Well, during the pandemic, we took extra, we followed all of the CDC guidelines and in some cases plus more to be sure that everyone was safe in that regard. We, during the pandemic, corporately, we didn't allow, except on a very limited basis, did not allow any visitors in the building. And we were, for the most part, almost 100% remote working. And so those are some of the things we strictly limited access to anyone who came in the building. Like I said, we had to follow all the CDC guidelines in this. And sorry about that little technical difficulty there. And so that's what we did. And then so like I said, we put in a lot of safety and security protocols that we made everyone follow. And just only now in the last, couple of months have we started bringing people back. We finally just started this week, as a matter of fact, have basically completed our return to work program or plan. And so it's finalized, but of course, the number of people back in the building is much less than what it was 2 years ago.
Sort of
Steve?
Chris, sort of along the same lines as Burke. We definitely sort of seized the moment from the safety and security perspective to be able to do what we may have wanted to do prior to the pandemic, but just may not have had all the support that we've needed to create that safe and secure environment. I have the fortunate role too of having environmental health and safety practitioners on our team, as well as physical security design teams. And the great part about what we were able to do was we were able to talk about emergency situations and what we would do, and then we were able to align physical security to maybe that emergency procedure. For example, in years past, we didn't have a badge out requirement when it came to our policy or process around our facilities. During the pandemic, we took that time to work with our partners to create that capability among our higher density locations, admin facilities, for example, our corporate tower, 5,000 people. So we initiated the fact that you have to badge in and you have to badge out. And the justification behind that to leadership, of course, was, well, for emergency situations, not only pandemic related, but active assailant related, we need to be able to understand who's still in the building, right? So that's one of those areas when it comes to visitor and staff management. We also created a more rigorous responsibility and accountability on our associates to understand what that visitor protocol is. You can't just go and accept someone at the front gate and bring them in, right? Like, here's the expectations, and this is why we have these expectations. We're still working on, because of the amount of visitors and the differences in our facilities, we're working on sort of this consistent approach to visitor management, which I think is, something that we'll get through probably in the next 12 months or so. But, it's as simple as creating badges now, for example, that fade after a certain amount of time, right? So you're a visitor, and if you see that red color on that badge as an associate, it's time for you to either approach that person in a very compassionate way to ask if they're still a visitor, or, contact your local security officer to ask that question. So it's as simple as, badging requirements for visitors and for staff. And at the same time, how you align it to emergency process within your organization, and getting your physical security designers to support that environmental health and safety initiative as well. So a lot sort of built into that, but we have become much more aware of who's in our facilities, why they're there, and our associates are taking full accountability for that.
Thanks. So we'll stay with you, Steve. So obviously we're in this new world of reacclimating colleagues back into the workplace, but clearly there's going to be some hybrid type of work environments where there's probably some days spent in the office and at home. Now, what would you say your level of responsibility is to protect your colleagues while working in the home? How far should you go as a security expert?
Yeah. So I just think it's different. It's a different way of thinking than maybe we had as security and safety practitioners been accustomed to prior. I think leadership, no matter whether you're in safety or security at all, or have any familiarity with the process, believed that we sort of had to be in the office to do what we need to do. Obviously, we've sort of we've gone a different route. We have probably 60% or so of our associate base working in the home now, in comparison to maybe a 30% number in years past. It's done a lot of good for us, but the expectations, like I mentioned before, of the associate now are much larger. I fully support the fact that we're in this new way of working, and that we as safety and security professionals have to be really curious and really innovative around the programs that we're starting to develop. So we've started to prioritize some of those. We initiated an app for all associates through a vendor to be able to report incidents, even take photos of things that might be occurring, or even the after effect of something that occurred at a facility, for example, to be able to support us and sort of be force multipliers out in the field. We also use a lot of different platforms now with understanding what incident that may have occurred, whether it's weather or a man-made incident, and how it's impacting our associates, and being able to reach out to them with a mass notification tool. So it's definitely something that we're learning more about. We would love to be able to fix that. I use the term fix the rug inside the house, because of a safety hazard too. Right. So all of our homes are a bit different. We were joking about it earlier, with teenage kids in the home, and the inability for, all the wireless to be there, or the sporting events. We have associates and team members in homes that might not be as tidy as we would like them to be. So it's really about educating them on everything from ergonomics to what they can do with their local law enforcement if they have an issue. So again, I definitely think the safety and security world is definitely changing, and the expectation should be that we're supporting them, all of our members, outside of the workplace.
Yeah, no, for sure. I appreciate that. Burke, thoughts?
It's still a learning curve for us as well. Having so many, the numbers are still out as to how many of our associates are 100% work from home. I would say it's probably somewhere in the neighborhood of about 30% that are 100% remote. But that, like I said, the final numbers are still not in, at least not to me yet. So it's a learning curve for us. It's also making us, because even for those who are maybe, but most of our associates have some sort of hybrid schedule. So they're in the office a number of days and they're working from home the balance of days. But it's also forcing us to rethink some of our emergency procedure plans, because some of our emergency response plans, such as say an evacuation or whatever, is the plan is highly dependent upon people to get everybody out and to account for them. And so we're actively reviewing that and a lot of our other security procedures, like we can't continue to do it the way we used to do it in the past. Yeah, it's still, it's a learning curve and an adjustment for how we're going to move forward.
Yeah, so there was a question that came into the chat, and we'll get to the we'll get to the second question here with the next question we have planned. But when you talk about safety and security at the home, can you share some examples of where maybe examples of things that because we talked about how far should you go, right? Because it is unique, right? It's their home, but at the same time, there's obviously a need. So do you have any examples of that that you can think of offhand? Either one of you?
Yeah, Burke, I'll go first. Yeah, so I mean, there are incidents, for example, so if you're living in an apartment complex versus a single home, right, you might be impacted differently by occurrences, right? Maybe it's maybe it's an issue with an apartment nearby. It could be, again, something that was man-made or created. It could also be, like we discussed, the lack of electricity or power being down because of a weather event, and how you sort of, where Burke was going with business continuity, where you need to be able to support their business continuity. Are you going to ask them to pick up their equipment and go find electricity? Or are you going to have protocols in place to allow them to do something different? Again, I say that because, we're closely aligned with our cyber partners as well. And we require, obviously, our users of our equipment to VPN in a safe way. So that's part of it. Whereas normally, if you were in a facility, you could just pick up, go to a different workstation and do your work, even in an environment like Louisville, where we're based, our corporate tower is based. But then there's also these incidents that are occurring that you can't make up, right? There are workplace violence incidents or home place violence incidents. There are also associates that can't necessarily work in their home, especially in the summer, right? So it's your responsibility as safety and security practitioners to get them to a place or provide them options, at least, to do the work. Then I mentioned it before, but there's this need for us to make sure that even their work environment is safe, right? I'm working in corporate tower today. My environment's pretty clean, but at home, and I'll share this, sometimes my desk and the space around me and the wire hazards that are connecting every device that I have are down to my lower left, right? I get up to answer the door and I trip, right? These are type workers' comp type issues that could occur in the home. And so it's for us to educate them on creating a safe and secure work environment, which now includes your home and the expectations there. So just a couple different examples, different extremes.
No, I think those are good ones. Burke, anything to add?
No, not really. I think Stephen did a great job of covering it. It's still a learning curve for us, and exactly trying to determine how far you go. We do make them sign agreements, and our human resources people handle all that and make it very clear as to what their guidelines are and what their responsibilities are. In regards to everything he just talked about, from safety and all these types of things.
Yeah, great. Well, we're going to stay with you on this next question, Burke. So obviously, home health is a trend that continues to be on the rise. Healthcare professionals are going into members' homes to provide care. This obviously is occurring on the insurance side and the hospital side. It's that whether it be telehealth or actually home care itself. What's your role in protecting your healthcare professionals that are going into the home, taking care of patients? How far, again, should you go to protect these colleagues So I guess Burke, we'll start with you, and then we'll come back to Steve.
Okay. Yes, we are getting into that space and have been easing into it for about the last 2 years, I guess. It kind of like the work from home associate is still kind of a learning curve for us because it's new. We haven't been in that space for a long time. I think a lot of it goes back to what we've already touched on at the onset of our call, is properly educating them on how to be safe and how to protect themselves. We do offer offices. A lot of what they do is meeting in homes, meeting members in clinical offices, hospitals, so forth and so on. But we have a number of offices strategically located around the state where these case managers, clinicians can go and meet at a neutral location that is our property to meet with these people. So for whatever reason that they don't feel safe, or there's any other reasons going into these homes, then we provide an alternate secure location. Early on that line of business, they tried meeting in neutral locations like coffee shops and things like that, and they found out that really doesn't work. And that's obvious. I think for obvious reasons. So we have provided these what I'm going to call safe locations where they can come and meet, have privacy as well as security.
So are these buildings that maybe you have leased, or spaces you have leased where they can come there? That's maybe not in the acute care setting or somewhere like that, but somewhere for one of your member hospitals or whatever, but maybe just in a lease space where it's HIPAA compliant, it's private, that type of concept.
Yes. So there are the spaces that we control, that we lease, and is what we use. Okay, some of it's shared space that they share with other lines of business, other operations of the company, and some of it's space that we lease specifically for this purpose.
Okay. And then supplies obviously would be carried by the home healthcare professional that's coming in, right? So you don't have to worry about setting that up in these spaces.
That's correct.
Excellent. Steve.
Yeah. So to add on to Burke's comments, we do have sort of a similar way of meeting our members under different business lines for different types of care. One of the things too that, I know we're probably all aware of is just our responsibility under the duty to care clause. It usually starts, I will say, on the West Coast and sort of makes its way to the East Coast. Some of the new directives and regulations. We're trying to be as progressive as we can and get in front of this. One of the successes that we've had is meeting with other security and safety practitioners like Burke, of course, within our industry, our healthcare vertical, to understand that we are in this together, right? Because there are many clinicians that might, for certain hours of the day, be working for Humana. That same person might be under contract to work with Blue Cross Blue Shield at some point, and even one of our other healthcare industry partners. And so during that entire day of work, they may be working for others. It's still our responsibility as an industry to support their safety. And so what we're doing is, again, under a lot of NDA and a lot of conversation, trying to create a single way to support any type of events that might occur in the house, in the home. We're definitely meeting our members for the most part in the home. And again, not always in a safe home, not always in a safe location. So we've established lone worker technology. Many countries beyond the US obviously have been involved in this for quite some time. Oil rigging companies, other industries, to protect their associates when they go out on their own. Whether that's accelerometers that are based in like your iWatch or in your iPhone, if it were to drop and it would send a signal to our fusion center. But at the same time, the ability for us to monitor our clinicians when they go in the home, as simple as having an iPhone or an Android phone and having a tether that can be removed by the clinician to support whether it's reach out to local law enforcement or it's to sort of reach back to our fusion center to establish some type of presence, right? Now, granted, the presence, depending on the situation, is not going to be there in minutes, but at least that practitioner knows that somebody knows that they're in danger. So lone worker technology is played a big part in sort of our roadmap for addressing these in-home issues.
Do you find that in that situation? So let's say there is a panic button or like staffed arrest type solution. Do you typically want that to go to your fusion center and to local law enforcement at the same time, or directly to local law enforcement first, and they let you know? What does that process look like?
So it's very it's multifaceted. So the fact is that depending on when we roll this out to the different and how we roll it out to the different business line leaders, they all have different expectations based on the work that they do. For instance, a clinician going into the home has probably been into that member's home before, and so they're aware of some of the dangers, right? There's a creation of a understanding between the member and the associate. So there's a different risk profile associated. Whereas you have agents that might be going out to sell insurance to people that they've never met before, right? And those people may or may not want them to be there. And so they have to be trained, like we started the conversation off, in a different way. But to answer your question, it's different depending on where you are. Big city, small town, it's dependent on who you're seeing, the audience. So we prefer for that first call to be to 911. Right? Especially in an urgent situation. So there's very few cases where it doesn't go immediately to local law enforcement. If there's and of course there's a process to this, if it's not something that local law enforcement can do immediately, it goes to a command center through our vendor who triages that, and we're informed, right? There's not a whole lot that we can do from here in Louisville for somebody in Des Moines, Iowa immediately, except know that we need to monitor this closely with our vendors. So different, answer your question, different protocols for different business lines.
Got it. Burke, anything to add to that, or no? Okay.
No, I'm good.
Okay. So there was a question that came in. It's really for both of you. And then I have a question on physical security as it relates to cyber, and Steve will come to you for that. But the question was, do you have a system today that gives you a dashboard or snapshot in real time of your employees working in the office versus the home? So on a daily basis, are you aware of how many are in office or at home?
Yes, we are. I am.
Yeah. Okay. Yeah.
Well, okay.
Go ahead.
No, go ahead. What does that look like? I mean, is that do people have to clock in so you know where they're at? How does that work for you? Because obviously you have some salaried individuals, right? So they're, if they're not getting paid hourly, they're probably not clocking in and clocking out every day. So what does that look like?
Yeah, Burke, I'll go first just real quick. So depending on the type of facility, again, whether or not it has our new enterprise access control capability, everyone has a badge, right? A smart technology badge that allows us to see, and I mentioned before, come and go. And so those numbers throughout the day will fluctuate based on facility. We heavily leverage Power BI to understand who's in the buildings. So you could look at a Power BI dashboard today that our physical security practitioners utilize that shows by ORFAC or by facility code who's in that office space. And it will fluctuate. So I often get requests from our senior leaders as to how many people are utilizing our space and what's the trend. I will tell you that the trend in the new work environment for us is Monday, Tuesday, Thursday. Wednesdays and Thursdays, our numbers go down, right? And I think it has to do with that hybrid work style, but also has to do with how you're balancing your personal and your professional life, right? So we do have that that real-time capability to understand our numbers in our facilities.
Burke, what do you use? Are you using a Power BI as well, or something different?
No, we're using something a little different. We use our Secure 9000, which is our force access control system, and we use it to. And this is actually an outgrowth of the pandemic. But prior to the pandemic, we did not do this. But when it came down to the concern of social distancing and all of that, and wanting to keep your numbers down to prevent that, that's when we started monitoring building occupancy much more closely. So we pull reports out of Secure on a daily basis, and we know exactly how many individuals have been in the building. Now, we don't monitor it quite as closely as Stephen does, and the outgo. We just, but we do know what our occupancy is each day in every building that we have.
Excellent, excellent. All right, Steve. So coming back to you on this question. I mean, obviously, I get feeds every day, right, on some of the cybersecurity challenges the industry's facing, right? And I know it's top of mind, obviously, probably for your CISO there within Humana, and I'm sure same for Blue Cross Blue Shield. What safeguards have you put in place to avoid breaches through some of the physical and electronic security infrastructure? Obviously, in any building, there's all these access points, right? Sensors or otherwise. Talk to us about that and kind of how you're bridging that physical security, electronic security strategy with cyber and how that connects.
Yeah, I'll keep it sort of broad, Chris, just so that, again, there's some opportunity to ask some questions, but goes back to that. I will tell you, and again, in full transparency, our relationships with a big corporate organization sometimes have to be, we have to be really intentional about them. I will tell you that our CISO and I and our chief risk officer are pretty well established, so we know who needs to be informed when. We also exercise these types of breaches on a regular basis, right? It's definitely one of the concerns that many of us probably have within our 10K for our companies is this cyber piece. And so there is this separation right now, but there's a lot of tentacles connecting between the physical security and the logical security practitioners. Again, it's a relationship that we've worked on for quite some time. We're in a really, really good place to understand that, when physical access is terminated, does logical access get terminated at the same exact time, for example? So some of this is internal systems to us. But then when you talk about some of the products that Convergint and others are providing, it really has to do with leveraging and building those relationships with those subject matter experts, almost to the same answer as question one. I cannot, I definitely have some education in the space. Keeping up with the changes in technology is something that I expect of my strategic business partners like Convergint to tell us what we need to know. Whether it's a licensing issue or it's a software issue, making sure that those solutions provided by Linnell or by Convergint align with our IT standards and protocols, right? Encryption and things of that nature. So there's a huge need for us, and we haven't gotten there yet, but I've talked to some of our team members about embedding an IT person, right? Someone who has that subject matter expertise within our team. Probably won't ever happen from an organizational chart perspective, but it, from a relationship perspective, has to happen because they need to sort of check and balance what we're trying to do and be innovative and progressive with our technology that we're installing on our facilities. Needs to make sure that the infrastructure is there to support it, and the bad actor, isn't as progressive as we are. So, again, it's always staying a couple steps ahead, but those relationships are really, really important.
Yeah, no, and it, and I appreciate what you said there too. I mean, I think it takes a village, right? I mean, we're, part of our role, obviously, as an integrator is to stay up with the latest and greatest in technology and bring that to you, have that discussion, and make sure that we're addressing those needs. So that was really helpful. We're going to come to you next on the next question, and really our last one here, unless some come in through the chat, and then Steve will give you a chance to comment on it as well, that you can touch on a little bit. As a high-level security professional, you're responsible for ensuring you really limit the amount of legal liability risk to your institution. There are elements of the role that you have. What advice do you have to others to avoid potential security-based lawsuits? How do you work with your risk management based colleagues as it relates to this concern and where that kind of interface comes in?
I think it all starts with creating a culture of safety within your organization. And I think we have that here, a very strong culture. And I think, and there's a lot of things that can contribute to that. I mean, the company wide from the top down takes safety and security seriously. And so when you bring things to their attention, they're usually all ears and wanting to hear what you've got to say. So a lot of us, just having sound policies and procedures in place and sticking by them and constantly reviewing them. And this is a fast changing world that we live in. And so what worked last year may not work this year. And technology plays a bigger role into those policies and procedures and how you operate, because technology is changing so quickly. But so, in projecting a professional image, and I think, talking about the culture of safety is, so we rely heavily upon contract security officers to help us in our overall security plan. And we have some very stringent standards in place to first just to even qualify to be a security officer here. We don't just let anyone do it. We have not only very stringent screening processes, but we also have very stringent training guidelines that they have to go by. So we want to, as I try to say, we want to be a cut above. And so we're very intentional and careful of who we allow to do that. And then we collaborate a lot, like Stevens alluded to. We collaborate a lot with our partners within the company, InfoSec, legal, our audit team, all of these, working together to address each other's concern and try to be very proactive. We take our audit, we do a lot of our own internal audits. Of course, obviously, we are audited a lot externally by others, and we strive to not only meet their standards, but to exceed it. And that's one of our measuring sticks that we have around here. But we have a lot of checks and balances internally that we do on a very regular basis to try to find the problem before it's caught by someone else and fix it.
Excellent. Thanks, Burke. Steve?
Yeah, and Burke, I'll echo that. I think it's really interesting. In years past, we may have looked at that internal audit and the external audit piece as something that was burdensome for whatever reason. I actually really, really encourage those teams to sort of support our physical security and safety practitioners in a way that tells us in advance what we need to be looking for and what their concerns are before it actually happens and shows up on my leader's dashboard as a high risk or medium risk issue. So, I would say, sort of in my role when it comes to that all hazards risk approach is having a really, really controlled but audit capability. It's something, again, from, maybe 3 years from now, I'd love to have our own internal audit, subject matter experts that come into our space that ask all the right questions to tell us what we need to do differently so that we can get ahead of the problem before it shows up at our doorstep. One thing too, which I think is, something that I've used and it might be beneficial to folks on the call as well, is the SEC each year puts out, it's not each year, it's every couple of years, they put out board level risks that they believe we as safety and security practitioners need to be aware of, right? And it breaks it down. They haven't changed the photo in years, but the fact is that every domain that they mention, we've hit on today. But it's our responsibility as the senior security professionals within our organization to dig a little bit deeper into each of those domains and say, are we thinking about this? And then at the end of all that, and it's not that it just happens once a year, it probably happens every quarter, working with our chief risk professionals to understand what the company from a risk perspective has as their top priorities or top concerns, and then aligning your programs to that. Sounds really simple, takes a lot to actually get there, but we've been very successful in saying, hey, this right now is our top priority. It might be data governance, for example. Well, how does data governance, even though it might not mean something specifically to us in safety and security practitioners, we definitely have systems like Power BI and others where there's data. do the least privileged amount of people have access to that platform, right? So again, from a lawsuit perspective, staying close to our chief legal counsel and others about what they're seeing and what their concerns are, really, really important. And it all happens in a really informal way. I think is something that's really important too, is making sure that, the objectives are set out of the conversation with these folks, but at the same time, being really transparent as to where we actually are, so that they're not misled to believe something that we're doing that we're actually not, right? So I think it's just open conversation.
Excellent. Well, I don't see any other questions that have come through the chat, and this kind of wraps up our panel today. So first of all, Steve Burke, I want to just a huge thank you on behalf of Convergint. I know that, obviously the participants that were on today, I think probably learned a lot, got a lot out of it. And I know there'll be a lot that will watch the recorded view of this over the coming weeks and months. So I just want to thank you for the time today. I know you're both really, really busy, especially in this crazy world that we're living in today, right? But can't thank you enough just for the education today. Really helped me. I took some really good notes as well. Learned quite a bit, and looking forward to continuing to partner with you and other industry experts across the healthcare ecosystem. Just thank you so much.
Absolutely. Thank you all.
Thanks, everyone. Bye-bye.